feeling today? Good. That's wonderful. Do you remember me? No. I'm Sister Rachel. You did come in with quite a bit of head trauma, but the doctor did his best to get most of the shrapnel out, but that's why I'm here today. I'll finish what he started, so I'll have to give you a new dressing. I'll go in and take out any extra little bits that you might have in there to make sure that everything is healing quite nicely and that you're in a good amount of comfort. Yes, there was a bit of an explosion, and luckily you made it out of that quite intact. However, you did sustain a little bit of injury to the head as well as being knocked unconscious from the blast, from what I'm told. But overall, you are actually looking quite remarkable for the injuries that you could have sustained. But as long as you are comfortable, I can go ahead and get started if you'd like. Okay. And it does feel like you've got a little bit of a fever happening, but that is absolutely normal and okay. It just shows that your body is fighting any sort of infection that you might have had. So it's actually a good thing. Now, first off, cleanliness. Well, the great nurse, Florence Nightingale, was one of the first to really make an importance of hygienic practices, especially among wartime and serious injury, to make sure that there were no complications and that people are healing as best they can. So I will just go ahead and take off this first dressing for you so I can go ahead and examine. And do you have any sort of real heavy pain or anything like that right now? Okay. Do you know what the day is? Good. And the president? Excellent. So it does appear that you still have a slight amount of bleeding. So I'll just go ahead and get that all cleaned up for you before I really go in and try to take anything out that the doctor might have missed. Okay? So, how long have you been in the service for? I thought so. You looked pretty young. Well, I find that most of our servicemen these days are getting younger and younger, unfortunately. It seems that they don't have as much time to really be boys anymore. most people find it pretty relieving. And I think the cool sensation on the skin, especially when you have a fever, feels particularly nice. Excellent. Okay. I think that looks pretty good. It does look like you've got one particular spot over here that I might have to go in a little deeper with. And I'll probably have to give you a couple sutures over there, but it shouldn't hurt too much, okay? So. I'm just gonna go in and very delicately try to pluck out some of the shrapnel that the doctor may have left behind, okay? And if at any point this feels uncomfortable for you or painful, please do not hesitate. Just go ahead and stop me and let me know, alright? I want this to be as comfortable as possible for you, and it should not hurt. Alright. Okay. You're doing really good. And again, nothing too painful. Wonderful. So do you have a sweetheart back home? No. Well, I find that very hard to believe. Well, you're certainly a very healthy and well-spoken individual, which we don't always get. And I can't imagine that there isn't at least some young thing back at home who isn't thinking about you. Well, I find that wartime often can help people realize their true feelings for one another. Okay. I think we're almost done. One. Rather tricky part here. Certainly don't want to hurt you, but do you need kind of a two-handed situation here? think that looks pretty good. And again, is it too painful or anything? Great. Then, unfortunately, I do have to give you a couple sutures on that spot. You had one piece that was a little bit deeper, but I'm sure that at the time the doctor maybe just looked it over or was in a bit of a rush and wasn't able to spend the time that he'd prefer on that. Let's see. This won't hurt either, no. And I say that because typically after some time that when you have sustained a bit of an injury like this and you've been having a little bit of time to recuperate already, the body typically puts a little bit more attention on that area. So most of the time it's already used to feeling a little bit of pain and will naturally numb it. But there is a time limit there, so we don't want to give you anything that your body can't handle. Alright, are you ready? And if this hurts, do please, again, stop me and let me know, okay? Wonderful. Alright. Alright. There is one. Well, I have a different technique. I like to do them all in a row and then finally cut them at the very end. I know some people like to do them one at a time, but I find that this is a more efficient method for me personally. To make sure I did that all right. Yes, I think that looks great. So let's go ahead and give you a little bit more of a thorough touch-up. I like to spray some of these cotton balls with our antiseptic, and part of that is to make sure that you are touching as little of it as possible. bit, so gives it almost a little bit of a cooling sensation, right? Okay. And I am going to administer a little bit of a shot there just to make sure that you don't develop an infection. Okay. Well, I'm actually just doing a small bit in the area itself and some of the surrounding area. I'm also going to give you a tiny one over here, okay? Perfect. That wasn't too bad, was it? Well, I'm going to give you one little bit of extra special cleansing agent, and then I'll administer a small bit of ointment. And then you should be all finished. Also, don't tell Sister Mary, but I did sneak you a couple cookies. Sometimes I think she likes to make this place as uncomfortable as possible. I don't know why. I think she's just spent so much time with the Lord that she forgets how to treat everybody else. God, you are doing absolutely wonderful. If all my patients could be as good as you, I would have the easiest job. All right. Now, one last thing. And this is just something that I like to do. This doesn't have any real medical properties to say, but it's just a smell that I make that I think is quite soothing. And I find that it helps in general to calm the body a little bit more. It's something that my grandmother used to make for me when I was sick. And just the smell of it alone just really warms my heart a little bit. A little bit more? Okay. This is the last one. We need to share. Well, I like to warm it in my hands first because it helps release some of the scents. Kind of like when you're cooking, how there is a big difference in smell from when you are making the cookie dough to when they are baking in the oven. So nice. Okay. Well, I'll give you a new wrap. There it is. Now that I've got you all nice and clean and sutured, and then I'll let you get on to your business of nap taking and eating and whatever Sister Mary has you doing for tonight's activity. I know, it's usually prayer, but you know, you'd think that she would want to give you guys a little bit of fun. But I know she won't let you have cards because she thinks they're the devil's game. Okay. Now, one last thing. Now, these, the dose is on the bottle, but make sure you are taking one at least every day. They will help you fight any infection that you might have, which I'll also be here to check up on you. But in general, if you are feeling any sort of large amount of discomfort, you can take one of these. Don't take too many. Just only take them as you need them, okay? And once these run out, you don't get any more. So, use them sparingly. But I will leave those there for you. Now, I left your cookies by your bedside table. You just have to open the drawer. Otherwise, you look absolutely wonderful to me, and looks like you are quite cozy, so unless you need anything else or are having any sort of other trouble, I guess I'll be on my way. Okay? And if you need anything, just ring.